Good evening. It's every parent's desire to see their child hit every milestone successfully. Children achieve their milestones in different areas, like how they speak, how they move, how they act, how they learn, and how to play, among other developmental milestones. But there are conditions that may slow or halt these milestones, and autism or autism spectrum disorder is one of them, a neurodevelopmental condition that impacts mainly a child's communication and social skills. Now, what happens when a child is diagnosed with autism spectrum disorder? What are the treatments and interventions that can help in managing autism? How can one improve their child's speech? Those are some of the questions we'll be tackling tonight. And to help us with these questions and more regarding autism is Dr. Mary Madumadu, a child health neurodevelopmental doctor, live in studio. So I want to encourage you to inform your friends, a neighbor, a family member, and let's join together and be equipped in our discussion tonight. You can also share the link to this discussion. It's live on Facebook and YouTube. Our handle is at Hop TV Kenya. You can also interact with us for any question or comment you have about autism. Our SMS line is 22232 and our WhatsApp line is 0708 222 323. The numbers are right at the bottom of your screen. You can engage with us with any question or comment you have regarding autism. Good evening and welcome to a brand new episode of Health Check this week. My name is Grace Mutiso. Always a joy to be with you, and I'm glad that you could find time to join us. At this point, allow me to invite Dr. Mary Madumadu. Good evening, Dr. Ring.
Good evening, Grace.
How have you been?
Very fine, thank you.
Yes.
Yes.
I always love asking the doctors, how has your day been? How busy or light has it been today?
It has been, well, 50-50, both busy and not so busy, but yeah.
Okay.
Let's say average.
Okay.
Yeah.
Thank you. So let's begin by you helping us understand who is a child health neurodevelopmental doctor.
It's a subspecialty of pediatrics, children's doctors, but my degree specifically focuses on the development of the brain. So basically, I'm a doctor of a developing brain. I don't know if I've tried to simplify it the best I can, yeah.
Yes.
Yes.
A doctor who specializes in brain development.
Yes.
Can we put it that way?
Yes.
Okay.
Yeah.
So of late, you've seen there is a rise, in cases of autism, and it's more common now. Is it more common now, and how easy is it to be able to identify that this child is autistic or this person is autistic?
Well, it's true, there's a rise. Because when you think of autism, there's always the question of genetics and environment. Nature versus nurture, the eternal debate. Now, for me, I always say, I'm 51, so I bless the Lord. Yeah. My age is in centuries now. So I've been in this for the last 15 years. I never used to see autism the way I'm seeing it now. So what I know is that Kenyans will marry Kenyans.
Yes.
So I don't think the genetic pool has changed. We have not imported foreign genes into Kenya.
Yes.
What has changed? Our environment, nurture. Yes. The way we bring up our babies now, we are predisposing our babies to the risk of the genes of autism expressing themselves. Because you can have genes, there are many genes that causes autism.
Yes.
They're the big famous ones, Fragile X, Rett syndrome. I mean, they're big things. But there are many small ones that really don't have to express themselves unless they're helped. Yes. So,
wow. Scary, Dr. Madumadu. If you say it's nature, there are things you're doing as parents that is lightening up these genes to, to bring the symptoms of autism. That brings me to this question. What are we not doing right as parents?
Maybe I should discuss first when a parent comes to the office, how do we know the baby is at risk of autism?
Yeah, tell us about that.
A mother will never come to say, Dr. Madumadu, my baby has autism. The mother will come and say, my baby is not talking like other children.
His age or her age.
Her age.
Yeah.
I went to a birthday party and my baby did not talk like the others. My baby refused to play. My baby was throwing a tantrum. Or I'm very annoyed with that teacher because that teacher is saying my baby is like this. Basically, it's an issue of speech delay,
Yes.
an issue that is communication, an issue of socialization. Baby is not playing with others, is alone in a birthday party. I was embarrassed in the family meeting. Baby was not playing with the cousins. Or an issue of behavior. So when you look at it, when a mother comes, this baby is not talking. This baby has speech delay. What is speech delay? Because first you've got to understand, how does God make a baby develop speech for you now to understand autism in its entirety?
Okay.
When God gives you a brand new baby, you know,
Yes.
everyone is so excited.
Oh, yeah.
Big gourds of wimbi porridge.
Yes.
And that baby is also very excited. The baby is born with social connection.
Yes.
A little baby will stare and stare and stare. The part of the brain for staring is not in the vision part of the brain. I can look at you,
Yes.
but when I talk to you, our eyes meet.
Yes.
So babies are born with social connection. That part is in the talking part of the brain.
Okay.
And that part of the brain also now triggers, it switches on imitation or copying. There's a lot of data. God is omniscient. He has given us a little of his science,
Yes.
science is knowledge,
Yes.
for us to realize, actually, when a baby stares, it triggers a whole network of imitation.
Yes.
You see?
Yes.
Now, the network of imitation works when I'm looking at something very interesting I want to copy and when I'm actually doing it. Why did God do that? I'm born again, by the way.
Amen.
And all this information, as I say, it is from the Lord.
Yes.
You see, so why did God do that? It's because even though you're a 20-star Army general or you are Chief Justice of the Hague,
Yes.
you never talk to your baby like this. How are you, baby? My name is Mommy.
No.
Nobody talks to a baby like
No.
that. You are there. Hi, baby.
Yeah.
So,
Buju,
oh,
buju.
buju, buju,
Yeah.
buju, their eyes, their face.
Yes.
So baby is wondering, wow, these people are very interesting. They're really out to entertain me. So when you do that, what do? You strengthen the social connection. So baby really looks at you, baby is trying to copy you. You trigger imitation.
Yes.
Now baby initially is so small, they can hardly do anything, yeah? So they're really looking at this mommy and they're wondering, whoa, when I grow up, I want to do what mommy does.
Yes.
You see?
Yes.
Then a time comes, I've really simplified this whole story,
Yes.
that baby actually can do what mommy does. So mommy says, oh, do you want something to drink? And baby can copy and baby is, whoa, thrilled.
Yes.
You see, comes baby and baby can do that. Then baby starts wondering, wait a minute, these people, how come every time I copy mommy, she comes? Let's try it on daddy.
Yes.
Daddy comes. Oh, Nyanya has come. Daddy comes. Oh, can I carry? Okay, let me go in front of uncle and
Carry.
I'm carried.
Yeah.
Then baby realizes, wait a minute. These people are talking.
Talking.
These people are talking.
Yes.
This has a meaning.
Yes.
This has a meaning.
Yes.
You getting my point?
Yes.
So the social has triggered imitation, which now has helped the baby to understand you.
Yes.
So now when baby understands you, the middle class Nairobi English speaker, will be like, oh, come baby. So baby realize, whenever I copy mommy, mommy comes.
Yes.
Isn't it?
Yes.
So when mommy does this, mommy wants me to go to her. Every time mommy does this, mommy says, come. So this and come have the same meaning. Because when a baby is born into your home, they're not born speaking English.
No.
They have to learn it.
Yes.
So initially it's just a lot of noise. Wah, 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 wah. So that baby will hear, wah, 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 come. I know the meaning of that word, come. Who is calling me here?
Yes.
So the gesture language cooperates with the ear to pull words, meaning of words.
Yes.
You see?
Yes.
Now, speech then is 3. Baby must be able to say the word come. Baby must be able to hear
Yeah.
the word come, because the brain learns the rules of the language it hears.
Yes.
The baby in Mombasa, where I come from,
Yes.
baby ncho. We not learn come, we learn jo.
Joe.
You're getting the point?
Yes.
So the brain learns the rules of the language it hears. And then what I have been discussing is processing.
Yes.
So autism is a breakdown in that processing. You're getting my point?
Yes.
Yes. So
Wow.
social triggers imitation, which now triggers understanding, gesture language, then it pulls words.
Okay.
If you look at the definition of autism, it's a spectrum, meaning there are huge presentations. You're getting the point?
Yes.
No two same 3-year-olds will look the same, but they're baselines. There's a problem of social.
Yes.
You see?
Yes.
I told you social is part of communication. In fact,
True.
babies start talking with their eyes. As
Yes.
humans, we talk with our eyes first before we talk with our mouth.
Mouth.
There's a problem of course, communication. Because communication is this whole thing that I've talked about. And then there's a problem of behavior.
Okay.
So now, what we do, you see?
Yes.
And I always say this because God gave us media. Media is good. We learn a lot. Babies can learn a lot from media. But there is a medical way of exposing babies to media.
Okay.
Salt is good, but if you put the whole packet of salt in the plate, you won't eat
You
it.
will eat it.
It's the same thing with media.
Okay.
So when baby is 4 months, 6 months, others even when they're very small, they bought a big TV. So baby is looking at Baby Shark.
Yes.
So Baby Shark is singing. So the visual part enjoy the moves.
Yes.
The audio part enjoys the tunes. You know, music is dawa ya roho.
Yes.
So he's enjoying the
The
tune.
tunes.
The social part also wants to join that party. The social part wants to say, hey, Baby Shark, hi.
Come.
The social part knows when I talk to mommy, we connect.
Connect.
You see,
Yes.
will Baby Shark connect?
No.
So social decides, this party, me are not invited. This party, if you go to a party and somebody asks you, why did you come? Will you stay?
No, you live.
Even if it leaves.
So that's where the issue is.
Yes.
As our contribution as parents, exposing our children so much to the screen.
We are overdoing it.
So what do we need to do that is right?
Okay, I use the American Academy of Pediatrics guidelines. They have a lot of money, they have a lot of research, and anyway, most of the cartoons are from them.
Yes.
You see?
Yes.
Children 18 months and younger, these are the latest guidelines, yeah? 0.
No TV, no screen time at
0
all.
screen, 0 phone, 0 TV, 0 tablet, 0 anything with a picture, mnaangaliana, except live video chat.
What's that?
What's a video? Hi, mommy. Oh, hi.
Oh. Like a Zoom call, a WhatsApp,
Yes.
WhatsApp call.
Yes.
Yeah.
Yeah.
Something that will engage them.
Because mommy will talk.
Yes.
Will Cocomelon talk?
No. Interesting. Oh, I know you're watching us and you're saying, "Wah, I'm a culprit there who contributed towards my child, having delay in terms of speech." And if you have any question or comment, talk to us. Our SMS line is 22232. Or our WhatsApp line is 0708 222 323. We are talking about autism. And, I'm hosting Dr. Mary Madumadu, a child health neurodevelopmental doctor. Keep your questions coming. Bring them early on any of those platforms so that Hope TV Kenya will be getting to your comments very soon. So we reached at that point, I'm sure we're not able to define, the difference between autism and autism spectrum disorder. Is there a difference or it's the same? And what are the symptoms around that?
Okay. Autism, I think, is just part of autism spectrum disorder. It's a disorder because there's something that is not orderly. There's something wrong.
Yes.
It's a spectrum because it is a wide presentation. You see?
Yes.
Yes. In the old definition, there were many other small, they had divided it into autism spectrum disorder, Rett syndrome, pervasive developmental disorder, but nowadays they have more like consolidated it. For me, I like looking at it from the functional point of view.
Yes.
Yes. So for a long time, the diagnosis basically rotated around communication or speech delay, poor social interaction, and behavior issues, repetitive behavior. Yes.
Yeah. Break each one of them so that
Okay.
those who are watching it are able to tell, I think I've seen this in my child.
Okay.
I need to bring my child to a doctor.
Okay. So for me, I'll go back to the way speech delays.
Yes.
So we have a problem with social. Babies are born looking, staring. You see? So in autism, what do we lose? Eye contact. So what do people say? My baby is shy. No. He's like the grandmother. Or the grandfather. Men in our family, we don't look. You see, we don't like being disturbed. You're getting the point?
Yes.
My baby has no attention. Basically, your baby is not looking at you.
Yes.
Because babies, their whole entire being is to please mommy and daddy. So if you're struggling to get your baby to look at you, very big red flag. Very big red flag.
Yeah.
You see, because to me, it means we are losing that social connection.
Yeah.
If we lose our social connection, it will basically mean I'm not going to trigger imitation. You see?
Which is key in a
Which is
child's
very
development.
key. So many autistic babies struggle imitating,
Yeah.
just copying. You do something, they will not copy you. You see?
Yes.
So if they're not copying you, they will not understand you. So if they will not understand you, you will be at loggerheads. The brain is telling me I'm hungry,
Yeah.
but I have no gesture language. I can't point. You'll have 4, 5, 3-year-olds, they can't point.
On what they
can't
want.
express themselves. So what do? They'll take your hand and guide you
To what
to
they
the
want.
thing if they can see it. If
Oh.
not, they will guide you to the place, either pull your fingers, pull your hand, or push you. Now it's up to us now to guess. Because a 1-year-old will point to tell you it's that.
Yes.
Here, you give the baby this, they throw a tantrum. That's not what I want. It's thrown down.
Yes.
Whew. You get something else, they throw another. Until now, everything in the drawer is down there.
Yes.
Maybe it's the last thing that they want, then they go away happily.
Yeah.
You're getting my point?
Yeah.
So they have a problem with social interaction, usually poor eye contact.
Yes.
Is something that you can really tell very quickly. They cannot express themselves. They use their parents' body.
Yes.
They use. When somebody says, that, how do you know when your baby wants something? Oh, he or she pushes me or pulls me. Automatically I know. Because you're 3, 4, 5 years and you're being pushed, a 1-year-old will just simply show you what they want.
Yes, they want. True.
You see?
True.
So they can't express themselves. You see, so they can't point. They have no gesture language. Gesture language is poor.
Oh.
You see?
Yes.
Then after that, of course, now, they have not understood mommy. So they have no problem with voice production. We do a baseline hearing because it's part of the protocol, the word over.
Yes.
We do not want to miss out, you see, because a mother will not come, my baby has autism, it is my baby has speech delay.
Yes.
So you have to go through all the parts that are involved in speech delay.
What is that? The ears?
The
throat?
voice production is easy because
Yes.
a baby will see you, not
Yes.
like you cry.
Yes.
Vocals are working.
Yes.
Hearing, because you have to test.
Yes.
It's a really standardized thing. And then now, if the voice production is okay, the hearing is okay, but they can't speak.
Yeah.
So speech delay, they're not talking. So that's something else.
Okay.
And of course, these babies are very frustrated. So they're very angry. So tantrums is a big thing.
Yes.
Yes.
Okay.
Yeah.
Okay. Interesting. And apart from what you've mentioned, exposing our children so much to screen, are there any other causes of autism?
Okay, there are many genetics, there are many genes that are associated with autism. From where I sit as a neurodevelopmental doctor, neurodevelopmental doctors, as we deal with function, you see?
Yes.
So with function, basically what it means is that if a particular part of the body is not working, irrespective of the causes, it is not working. we need it to work.
Yes.
So genetics, of course, is a big thing, and there are many genes that are associated. But you may have the genes, but they don't have to express themselves. Why am I not dwelling so much on genetics? Because it will frustrate parents. I give you this genetic test, you get it. There's no treatment for it. I'm still going to send you back to, we are still going to do therapy, so I've really not helped you.
Yeah.
But if you have a good insurance, sometimes it is good to know. People say sometimes you can choose your spouses, but I don't think it has gotten there. It's not part of our culture, really.
Yeah.
Yes, it's really not. It has not gotten down to our culture. But genetics play a big role, and environment. Yeah, those two things play a very big role. After the Second World War, there were many orphans. Many people had died. Children are put in orphanages with very few caregivers. Many of those developed symptoms because now they were not stimulated. Yes. Yeah. The other thing that I've noticed that babies can present autistic-like are sometimes babies who have had a lot of challenges around birth.
Break it down for us.
Premature babies, maybe you have issues with oxygenation, you see?
Yeah.
So for me, from where I'm sitting, I think most of it is maybe the brain has suffered, and maybe these parts of the brains have suffered, because you see, the part of the brain for social interaction can suffer because of too much cartoons.
Yes.
Can suffer because you have one of the big genes. Can suffer because of maybe it was injured around birth. Yeah.
Yeah.
Yes.
So all these factors as a parent comes in,
Yes.
you're able to ask critical questions, you know, as part of
Yes.
diagnosis,
Yes.
to be able to tell what could be the cause.
Yes. Yeah. What could be the cause?
Okay.
Yeah.
Okay.
Yeah.
And are there different types of autism, or is just one?
Let me say abroad. If you're abroad, and you are given a diagnosis of, actually the proper diagnosis of autism the world over, is you have to do an assessment called the Autism Diagnostic Observation Schedule, the ADOS. When I finished my master's, the ADOS was when it was being consolidated. It was a new kid on the block. For a long time, people used what we called the MChat. It's a free online screening program, and I think many people still use it. So there's no lab test that you can do to have a diagnosis of autism.
Yes.
Yes. So the way the neurodevelopmental science is going now, we are going more into function. Why? Because we can use this same information to reverse and get good results.
Yes.
Yes. So it's a spectrum.
Yes.
Even though they are twins, they will present differently.
Yes.
Yes.
They can't be the same.
I cannot say never, never, never.
Okay.
But most of the time, it's a generalized yet very individual journey.
Okay. Okay.
Yeah. I don't know how to put it.
Makes sense.
Yeah,
Makes sense.
yeah,
Okay.
yeah.
And another question before we go to a break. What would be, for lack of a better word, Dr. Madumadu, what would be like the tough symptoms, you know, on the highest spectrum, and what would be the symptoms on the lower spectrum?
Okay. The worst type of autism is called Kanner syndrome. Yeah. And in Kanner syndrome, apart from social communication, behavior, we also have cognitive impairment. We also have movement issues, both big movement, gross and fine.
Yeah.
That's the worst. I have not seen it in my 10 years of practice in Kenya.
Yes.
It has been more of a textbook.
Okay.
Now, the mildest is basically you realizing, hey, my baby is in danger. You do the right thing and we come out of it. Yes.
Sounds so easy.
It's easy when the baby is young.
How young?
The younger, the better.
Okay.
Yes.
So
I have seen mothers
Yes.
who maybe have had relatives who grew up with autism. They're rare.
Yes.
So some of them pick it when the baby is not even 1 year of age because they have grown up with it.
Yes.
And they get up very quickly and their baby function well. Yes.
Okay.
Yes.
So the key thing for parents tonight is be able to interact with your child more and pick up something and avoiding screen time.
No, for me, I think the key thing with the key message to the parent,
Yes.
for me,
Yes.
as doctors, we take a mother's instinct very seriously. If in doubt, if you ask yourself any question, it's safer to clear the doubt to the professional
Yes.
rather than to say, let's wait and see. My biggest enemy is let's wait and see. Because for me, a baby's brain can heal itself. Under 6 months, I have almost 100% of what I call neuroplasticity.
Yes.
The baby's ability to heal itself. By 3 years, I've lost 50% of most of my function. No?
Yes.
I never lose. I never go to zero. But by 7 years, a lot of research is saying I might not get to my full potential. Although a 10-year-old brain is better than a 12-year-old brain.
Yes.
So for me, I say the earlier, the better.
Okay.
If you were saying, I'm not happy with my 8-month-old, let's see. You're getting my point?
Yes.
Although most of the time, the symptoms are clear around 4 years, 3-4 years. But if in doubt, why wait?
Go check.
Yes.
Okay.
Yeah.
Thank you. Thank you. I'm hosting Dr. Mary Madumadu, a child health neurodevelopmental doctor with us tonight on Health Check. We are talking about autism. If you have any question or comment, remember to engage with us. The numbers are right at the bottom of your screen. And our WhatsApp line is 0708 222 323. Our SMS line is 20933. Also engage with us on Facebook and YouTube at Hope TV Kenya. When we come back, I'll be asking Dr. Madumadu, so can a child be born without autism, but as we expose them more to screen, they develop autism? That's what she'll be helping us understand right after this break. Keep it right here at Top TV Look and Live. My name is Grace Mutiso. We'll be right back.
Every Wednesday at 7:30 p.m. Spotlight.
Do you feel that they are in a place where they can effect a Barack Obama moment?
When you hear the word of God and you hear Jesus is speaking,
Real talk on real issues.
You know, the Bible says faith without works is dead.
The truth of the gospel that will survive the time is not a health and wealth gospel.
When there is time to harmonize and bring one composite amendment.
With idealistic, thought-provoking guests.
So people come to be serviced, to be encouraged, to be empowered.
When the storm is over, you desire the closeness you have with God.
Hosted by Reverend Edward Furi. Hope TV is where you look and live, with an excellent selection of the best Christian programming consisting of local and international content, of inspirational stories, talk shows, Bible commentary, youth, health shows, children entertainment, contemporary gospel music, extended times of worship, live broadcast, news, movies, drama, Christian ministry programs, and so much more. Hope TV is another quality service from Christ is the Answer Ministries, with over 45% of authentic and credible local content every week. Hope TV is a sister station to Hope FM, Kenya's leading Christian radio station, with footprints across the country. Tune in to Hope TV, where you look and live.
Welcome back to Health Check right here, Top TV Look and Live. My name is Grace Mutis. I'm glad that you have joined us, and I hope you're enjoying your supper or your breakfast, depending on where you're watching us from, as we discuss matters autism. Please keep your questions coming. We have a few minutes before we wrap it up. Our SMS line is 22232. Our WhatsApp line is 0708 222 or you can get to our comment section at Top TV Kenya. Drop there your question or comment. We'll be glad to hear from you. So I promised when you come back, I'll be asking Dr. Madumadu, so can a child be born without autism? And as I bring them up, especially in this city of Nairobi, where we are busy parents, we are busy looking for money to take them to school and do other things. And as we expose them to screen, they develop autism.
That's true, because there's no baby who is born with autism, even though I have the genes for autism. When a baby is born, they're looking, they're enjoying mommy, and they're enjoying daddy. So what happens is now, when you expose them to screen, then now you enable that gene to express itself.
Yeah.
Yes. Because for me, I always go back to, why now? Why now?
Yes.
When I grew up, I think I only know one person who was autistic. He was in a high school I went to Alliance, so he was in the boys.
Yes, Alliance boys.
Yes.
Yes.
But he was a very bright person. You get to the point?
Yes.
For him to make it to Alliance, meaning he passed very well.
Yes.
You're getting my point? But right now, there are so many in a family. I mean, it's actually an epidemic. There's something that really, especially the COVID babies, who are brought up by laptops and iPads in the house. I thought COVID would make parents bond with the babies, but it looks like they gave the babies a screen because they felt confined.
Yeah.
Yes. So there is something very wrong. And if you Google virtual autism,
yes,
you'll realize this thing is in the public domain. Because for it to be called virtual autism, it means that, and for them actually to make the rules about screens, why would they make the rules about screens if they are not affecting babies?
Yes.
Yeah. So there's a lot of information in the public domain already.
Okay.
Yes. Yeah. So for me, I'll just say, God gave you your babies. Do not shirk the responsibility of babysitting them to
the screen.
to a cartoonist somewhere.
Oh, yeah.
Yeah.
Okay.
Yes.
What about those? Because I know we have parents who they do not expose their children to screen. Even some of them, they don't have screens in their houses at all. But their children end up having autism. What will be the cause?
That's why I say there's genetics. Because I may be, there are many genes, by the way, associated. There were 400, many small ones. There are the big ones and there are many small ones.
Yes.
You can be born, let's say, with many autistic genes, but you are in this very big family, very huge family. When you are 2 years old, you go stay with the other toddlers. You see?
Yes.
Now, food comes in one big karai. So your brain is telling you, you have many autistic genes. Wait for people to eat, then you go eat. You go there day one, the karai is empty.
Yes.
Say, I am autistic. I will wait for day 2, the karai is empty. Day 3, will you listen to your antisocial brain?
No.
As the others are run, you are running. If somebody holds a piece of ugali here, you will hold here, it will cut in the middle. You see, you may be the quiet person, but you may never be fully autistic. You may be odd. You see, the nerd. You see, but you will somehow function.
Okay.
You can be born, which is highly unlikely, without any autistic gene.
Yes.
And from the time you are 4 months, you're put in front of the sofa set.
Yes.
And nobody talks to you. You wake up to a big screen, you sleep you are fed to a big screen, you will be autistic. Why? Because those parts of the brain will not work.
Yes.
Whether they're working because of genes or environment or both. Bottom line, they're not
working.
Yes.
Okay. Yeah. I hope you're listening and watching parents do something. Let's sample a few questions before we get to advise parents now. So what are some of the interventions we have and how can parents move forward if they have an autistic child? One of our viewers writes and says, how does diet affect a child with autism spectrum?
Diet does not affect a child with autism spectrum. Scientifically, diet is associated with attention deficit hyperactivity disorder. You see? Children on the spectrum have behavior issues, and some of them, the behavior, they can be hyper. So, as a doctor personally, and I know many parents will be like, oh, but I do not use diet. Because you see, for me, I'm working on specific brain parts. If the part for eye contact is not working, whether or not I use diet, if I'm not going to fight for eye contact and get it to work, it will not wake up. You see?
Yes.
But if that helps you let your child calm down so that life is easier in your house, that's fine. So diet will not cure or repair the brain parts that are affected in autism. For some children, they will help the baby calm down.
Yes.
Yes.
Okay.
As a doctor, there are also other ways. You know, Kenyan mothers are averse to medication, but there are other ways that can also help a baby calm down.
Yeah.
Yes.
Okay.
Yeah.
Thank you for that. Another writes and says, hello, I'm enjoying the program. Is autism treatable? I know a girl who is 4 years, but she uses the parents' hands to get what she wants. She is also moody. She loves specific colors. This is Wambui watching us from Nyeri.
Autism can be managed to the point whereby the baby gets normal function and people cannot tell the difference. There's a huge research, because there's a lot of research that is going on, yeah?
Yes.
The way I personally manage autism, it's two-pronged. Family therapy and the professionals.
Break it down for us. What does it entail in the family and the professional
Okay.
one?
The research, I'm talking about specific brain parts.
Yes.
So there's this research that looked into those brain parts, and they did what you call functional MRI. It's not the normal MRI we have, you see. And then they realized if this part of the baby, when baby was born, it is like this. Then in autism, it went down to this point.
Yes.
For us to get it back like this, for children under 2, it took 2 years, January to December, at 20 hours a week of therapy for it to go back to normal. Once it goes back to normal, whether you have the genes or not,
Yes.
people can't notice the difference in behavior, which is function.
Yes.
So what did they do? They incorporated parents, because there are two things, time and skill.
Yes.
So there are some things, like getting your baby's eye contact back. Mommy can play peekaboo, because what is therapy? Therapy is playing with the baby.
Yes.
Our babies just understand one language, play. So
regardless of their age.
In fact, they don't care. Me, I'll be talking about the mirror neuron system, that is, I don't know, inferior parietal lobe. They don't care about that.
Yes.
All they want to do is play. So parents are already playing with the baby.
Yes.
So we teach the mummies, the daddies, the nannies. In fact, those nannies, those maids,
Yes.
are my biggest partners. If they know how to play with the baby in a way that works on my brain, on the basics, then my professionals can do sensory transgression, things that they can't do.
Okay.
Yes.
Interesting.
Yeah.
Interesting. One more says, great discussion. This is one of our viewers and saying, my question is there a possibility of the autism process to be reversed? This is one of our viewers watching us from Kakuma refugee camp, and thank you for watching us.
Yes. As I've said, in this research, what they realized, yeah, the ones whereby they involved the parents and they had both time, the symptoms were reversed to a level where in that research, they said there was a cure because you couldn't tell the difference in the behavior of the baby. Yes. But it's a lot of work. And the family has to be willing to help. And if you have access to the professionals, we cannot replace them.
Yes.
If we do not have access to the professionals, at least if mommy knows what to do, it will also help.
Okay.
Yes.
By these professionals, who are you referring to?
Occupational therapists are a big, very big.
What do they do?
Occupational therapists, they play with babies. Actually, it's a 3-year diploma course in Kenya.
Wow.
Out there, it's a 4-year diploma course.
Yes.
But they deal with cognition, brain, and eye-hand.
Yes.
Yes. So they actually play with babies.
Yes.
But directed play. Therapy is directed play.
Yes.
Yes.
Okay. So that is one occupational therapist. Is there any other?
Speech therapy is also big.
Okay.
Yes.
What do they do with the babies?
Speech therapy is a 4-year degree course. They follow the way God has planned language. You see, my autistic babies have delay in speech.
Yes.
So there's the bit whereby the processing bits, once you get to a point I call vocal play, then now the speech therapist helps them quickly get to what they're, sorry.
It's okay, sorry, Daktari. As we allow Daktari to take a cup of water, please. SMS us your question or WhatsApp 0708 222 323 or our SMS line is 222 at Hope TV Kenya.
Yeah,
is
so
our
they
handle. Yes.
help
Yes.
the babies get speech. Yeah, it's a 4-year degree course. I can't summarize it.
Yes. Okay.
Yeah.
Thank you. This other one writes, was trying to get what she was saying. She says she's a special, she's a special needs educator, intellectual disability. Sometimes you advise parents and caregivers to reduce screen time on children, and they would, I'm not sure what she wanted to say. They would not do it, and so the speech delay. How do you get this to parents, or how do you go about these parents? As a teacher, you're telling them reduce screen time, but it seems not to be getting into the parents' heads.
There are guidelines, American Pediatric of Association guidelines. I use them a lot.
Yes.
Yeah. So you see, if I tell you, sleep under mosquito net,
Yes.
so that you don't get malaria, and you refuse,
Yes.
now whose problem is that?
My problem.
Yes, but the problem is you are exposing the baby, which is not fair.
Yeah.
Yeah, because you see, as children's doctor, our clients don't have power of attorney. We have to really lobby with the parents. So for me, I just tell the parents, Google, sit for yourself. Yeah, this is scientific, it's proven, it is in the public domain. You know, you can't even sue Google. Google will tell you it's in the public
Domain.
It's in the public domain. Yeah.
Okay. Another one writes and says, Paris writes and says, is autism genetic, signs and symptoms, and does it affect people of specific age?
They are genes. Genes are definitely there. As I told you, signs and symptoms. There are issues with social, poor eye contact. I'm a loner. I'm antisocial, tantrums.
And it's not a temperament issue, Dr.
It is
Madumadu.
not a temperament issue.
Okay.
Yes. In fact, these babies are frustrated. It's not a temperament issue.
Yes.
God does not give you a bad baby.
No.
They're not bad babies.
No.
Those behavior issues is because of autism.
Okay.
You've got to know that.
Yes.
So even as you help them get communication and they're able to express themselves, we are helping with the behavior.
Okay.
Yes.
Aye.
Yeah.
Please help me. I'm a mother of a daughter who is 8 years old, and the only word she can call is mom and baba. So hyper and produces a voice like ambulance. Please, can you help? That is Mary, who is writing in. And of course, before we wrap up the program, Mary will be able to let you know how you can get in touch with Dr. Mary.
Yes, I'd love to see that baby. Yeah. 8-year-old
Yes.
can be helped. A lot of hard work,
Yes.
but yeah,
It's possible.
it's possible.
Okay.
So, yeah.
What is the relationship between gender and autism? You find parents has both girls and boys, and sometimes boy and girls are twins, but you find the boy has autism and the girl doesn't.
Boys are 4 times more likely to get autism than girls.
Why?
I think when you go to health, but you see, there are some of these conditions, like Fragile X is one of the genetic disorders that are associated, and these ones, a female will have 2 X's. A male will have an X and a Y. Me, I am born again. I believe in XXXY. All those other genders, they're not mine.
Yes.
and I don't subscribe to them.
Yes.
So if you have Fragile X, if you're a girl and you have an X that is fragile and a normal X, most probably your normal X will take over. But for boys, what will happen is that you'll just have to use the one that you have because you have an X and a Y. So like many of the symptoms will present in boys.
Okay.
Yeah, but that is just one gene. There are many other genes. There's another called Rett syndrome. Now this one is a girl's. It presents in girls.
Okay.
Yes. Yeah.
Okay, but all of them are within the autism spectrum?
Yes.
Okay.
Yeah.
Sawa. And of course, as Dr. said, when you get to heaven, you'll ask Jesus, why, Lord? Why?
He's omniscient, we are not.
Yes,
Yes.
true. Another question is, there is a boy in Form 3 who only speaks to his siblings and parents. We teachers and other students read his emotions from his face. He hears well and understands instructions, but he doesn't talk to us. What could be the problem?
Could be on the spectrum.
Form 3? Okay. So should the parents bring this child for a checkup or something?
Maybe it would be good if they understood the baby.
Okay.
Yeah. Okay. So what? Okay. I'm not God. You see?
Yes.
I'm not God. Yeah. When parents bring their babies very late, I tell them, let's assume this baby is 1.
Yeah.
What would we have done? Let's do that, and let's see how far God will take us.
Okay.
And sometimes the Lord does surprise us.
Yeah.
Sometimes. Not all the times.
Yes, sometimes.
Sometimes.
Okay.
So sometimes it's good to have an understanding. Yeah.
Okay.
Yes.
Aya, this one says, my son is 5, can read words, but cannot communicate. Please help.
I need to see that one.
Okay.
Yeah.
Take your baby for check.
Because a 5-year-old should be communicating very well, very clearly. So if he cannot communicate, there's a problem.
Okay. By communication, what do you mean, Daktari? There are those who could say, Mom, Dad, I want milk or something, or totally no words at all.
A 5-year-old should be giving me a story. When we went, what happened, yes. If you're not giving a story, if your baby is not functioning like the age mates,
yes,
get help. Because they will do life with the age mates. If you're able to help, then help.
Okay.
Yes.
Thank you.
Yeah.
Ryan, thank you. Ryan is watching us. You're seeing your occupational therapist. Please go to @Hope TV Kenya. You'll get the link to this program. And please share with the other occupational therapists and any other parent that you're working with. Ask Daktari, how do you handle parents on diet issues? Because it's my major worry on autistic and hyperactive children.
You can, if the parents are happy with the diet, let them continue. I'm not going to dwell on it. You're getting my point?
Yes.
Yes. Because you're not the mommy. If the mommy knows, when I put my baby on gluten-free and dairy casein-free diet, baby settled down and life was easy.
Yes.
That to me is not an issue. But I'm not going to make a parent from Kibera start looking for an expensive diet they cannot afford. For me, where God has put me, I can go to the detail of. Autism diagnosis is social, communication, behavior.
Yeah.
Social, my posterior superior temporal sulcus is not working. How do I get it back to work? You're getting my point?
Yes.
Big words.
Yes.
My mirror neural system, which I have many other big words which I shall not in, is not working. My Broca's area is not working. My Wendigas is not working. How do I get it to work? So for me, and with the occupational therapists that we work with, because I'm in Gertrude's and I'm in Nairobi Outpatient Center. I'm in those two centers. Gertrude's in Nairobi, Gertrude's in Mombasa,
Yes.
and Nairobi Outpatient Center
Yes.
here in Nairobi. With the occupational therapists, we follow. First of all, as I told you, my mummies are my primary therapists.
Yes.
Because they do a lot of the basics.
Yes.
So mummy has got to know what to look for and how to look for it. Because I ask most mummies, if you knew eye contact is the beginning of speech, would you have let your 1-year-old lose it? They say no.
Yeah.
So you need to know the other things.
Yes.
You're getting the point?
Yes.
Then when they go to the occupational therapist, it's smart, specific, measurable, attainable, realistic, time-bound.
Yes.
We are not beating around the bush. Yes.
You're specific on what
We are very specific.
Okay.
So even with the reviews, it's very specific.
Okay.
Yes.
Thank you. I'd conclude with this one as I also ask you to speak to parents on what's the way forward in terms of the interventions and the treatment that we have. And just another parent tries and says, why is it that most children in urban areas are affected by autism and like those in rural areas? Does environment contribute towards autism? I'd love you to respond to that and just encourage parents. So what's the way forward now that I've observed my child is autistic?
You see, in the rural areas, like I come from a village,
Yes.
when you wake up, all the babies will be playing together.
Yes.
So they have a lot of social interaction. In urban areas, I live on the 12th floor in a flat. Going down there, some of these flats whereby there's no space for even playing. Everything is a parking space. So where does baby play? In the house, with the TV.
Yeah.
So social, as I told you, social is so important. Why does school help? Because you take your baby to school, even though you don't know what's going on, they will play.
Yes.
There are 2 toddlers. I want color red, I also want color red. So we have to negotiate.
Yes.
You see?
Yes.
So social comes up. As I told you, social triggers imitation.
Yes.
So you trigger the system. You see?
Yes.
So in rural areas, so long as it is the traditional rural area of mnatoka mnacheza,
Yes.
that's good. How can we get it in urban? Maybe school is the best. You're getting the point.
Yeah.
But if your baby has symptoms, that alone sometimes is not enough because it depends on the damage.
Okay.
If your baby has been on screen for so long, you will need help.
Yeah.
Yes, so it's always best when in doubt, clear the doubt.
Okay.
Yes.
Okay.
Yeah.
And for parents, as a word of encouragement as they raise up their children who are autistic, what would you love to tell them from an expert point of view?
With the knowledge God has given us, there are many who go back to full function.
Yes.
Yes.
Okay.
Yes.
It's possible.
It is possible.
Yeah.
It is possible. But early intervention, then knowing the right thing,
Yes.
and the parents have to be invested. Yes.
Okay.
Yeah.
And there are parents who hide their children because of the meltdown that they have. You know, they say they're throwing tantrums.
But even that can be managed to the point where babies don't throw tantrums. Get help.
Yes.
Yeah.
Get
Because
help.
you'll hide your 3-year-old. What will you do when that baby is 15?
Oh.
So help the baby. It's easier to help the baby when they're 3.
Yes.
It's easier to work through a 3-year-old tantrum so that it no longer exists.
Yes.
How will you walk through an 18-year-old tantrum?
It's tough. Thank you. Thank you, Dr. Madumadu. We really appreciate you for your time, and I hope our parents have learned. In a second, your parting shot, and where can we get you?
Okay. Okay. I'm in Nairobi Patient Center. I'm in Gertrude's Children's Garden, the Child Development Center, Muthaiga. For the people in Mombasa, I come from Mombasa, so I'm sorry the rest of Kenya, but at least I go to Mombasa. I'm in Gertrude's Mombasa.
Okay.
At least monthly.
Okay.
Yes.
Thank you.
Yeah.
Thank you. May the Lord bless you for the great work you're doing. One thing I picked from you is that you're very positive. There is hope for a parent who has a child who is autistic, and all things are possible with God.
Yes. God is omniscient.
Yes.
He has given us a lot of information.
Okay.
Yes. Yeah.
Thank you. Thank you. She's called Dr. Mary Madumadu. Our guest today on Health Check, you've been focusing on autism, and she is a child health neurodevelopmental doctor. And I hope you've learned a thing or two. Remember to catch a repeat of this tomorrow. Should be at around 10, 11. Yes, tomorrow. I had to look at my producer on the other side. And of course, you can also catch this anytime, any day at Hope TV Kenya on YouTube and Facebook. My name is Grace Mutiso. Always a joy to serve you this way. I wish you a blessed time. Remember to make a date with us again next week on Tuesday right here at Top TV. Look and live. Shalom and God bless.